Hello and welcome back to Your Health Kenya, a space where we get to unpack everything matters health. It is another Friday, another episode where we get to continue with the series that we have been having on reproductive health for women. And today's conversation, we get to unpack and understand everything in regards to endometriosis and adenomyosis. I believe that you've heard a lady somewhere, a friend, a sister, a cousin, a colleague, a workmate somewhere who's perhaps struggled with endometriosis, adenomyosis. And today's conversation, we'll get to understand what really are these conditions. And to do that, we continue with our conversation with Dr. Wasuna, who gets to help us unpack this conversation. Dr.
Thank you very much.
Karibu sana, karibu sana.
Information to understanding.
Yes, kabisa, creating health awareness and demystifying some of the myths or misconceptions or misunderstandings about some of these conditions.
Let's do this.
So I want us to begin by just unpacking what is endometriosis. It's such a long word. Endometriosis, adenomyosis. It sounds like, anyway.
Sounds like a low name.
Yeah. So it sounds like those big names I don't know, adopted from somewhere.
So let's just call it endo for short.
Endo.
Yes, but endometriosis.
Yes.
Okay, so let's talk about a uterus. A uterus, if you could imagine you would, a uterus, it looks like an avocado. Mm-hmm. Cut, remove the seed. Upside down. The fatter part is up, then it goes down like that. So the skin, okay, that's the outer coat. The fat that we eat, that's the muscle. And then there's a layer right inside, which every month, in response to a woman's hormones, grows, and at the end of the month, is shed.
If a baby, there's no conception.
Yes. That is the endometrium. So we have the lining outside, we have the muscle, which is actually called the myometrium, but the endometrium, let's go there. Now, there's a distinct difference interface between those two. Those are different layers. It's like the beach, there's sand, then there's land, and there's the sea. Different and distinct. And they're supposed to, maintain your lane. How you say maintain your lane? Stay in your lane. So what happens if this bleeding flesh, which responds every month, grows and bleeds, is found elsewhere? Not just where it's supposed to be. That's called endometriosis. So where else can it be found? Outside the uterus. It can be found outside the uterus where the tubes are. It can be found in the ovaries. It can be found on the intestines. It can go all the way to the lungs. We have seen it in the brain.
Wow.
We've seen it on the navel. So it does the same thing. Every month it grows. So when a woman is having her periods, it bleeds. So it's a form of internal bleeding where it's not meant to be. Hence all the symptoms that happen with it. So the common, of course, is pelvic. It's going to be within this area. So how does a woman know that she has got this endometriosis? Pain. The periods are unusually painful. And it could begin from just before she sees her period, the pain starts, to way after the periods have ended. The pain persists. And this can be excruciating pain. Okay? So when we do scans, or MRIs, those are more advanced imaging technologies, we see it. In between the cycles, she's fine. But when the period comes, my goodness. So heavy, painful periods are called dysmenorrhea. Painful periods, dysmenorrhea. So when you have these painful periods, a doctor should, at the back of his mind, actually the front of his mind, be thinking, let me investigate for this endometriosis. So to recap, this is the same flesh which is only supposed to be found in the internal part of the uterus, shed and coming out as a period, being found in other places, not just where it's meant to be. In the ovaries, by the way, the continued bleeding that happens can form cysts, and that blood ends up looking like chocolate. So we call them chocolate cysts. Okay? Literally looks like chocolate. When you make a cocoa without milk, it looks like that. So those are chocolate cysts found in the ovaries. It can travel far near the bowel. So she can have bleeding when she's passing stool, blood, because it's on the bowel, on the rectum, the anus there. She's quite close to where the uterus is. That can happen. It can be in the bladder.
And that's the endometrium lining.
And that same let's not call it lining, but that same tissue.
The tissue rather, not
it's
lining,
growing in
tissue.
the bladder.
Yes.
So she's bleeding
Yes.
from urine cyclically. Again, I've had patients who have it in the navel. She says, I bleed from my navel. Every time I'm having my periods from my navel. There you are. I've had a patient who's had it in the lungs. Recently, we lost a very precious lady.
Jambi.
Lovely lady.
Yeah.
I mean, you know, what a story, and God rest her soul in eternal peace, and her precious father. This was endometriosis, so you can see it can become tragic. So it's something we want to take seriously and to manage very seriously, and there are treatments for it. Now, the cousin of endometriosis is adenomyosis. It's a subset of endometriosis. We have said endometriosis is that tissue happening where it's growing where it's not meant to be. Where it is specifically found within the muscle of the uterus. So it's supposed to be in the lining, but if the lining is found, deposits of it are found within the muscle of the uterus, that's the adenomyosis. Now that one particularly causes heavy and painful periods. Heavy. While endo outside might cause painful, the adeno, the addition is heavy. And when we do scans, we can see it there.
Okay.
And there are treatments for it.
All right. So is it, I think I found a lot of women that I know who happen to have both endometriosis and adenomyosis.
Correct.
So does that mean that they come together, or are they just women who experience endo separately and adenomyosis separately, or, you know?
The same. It's just the same syndrome. It's just about where it's found. We just have given it a distinction based on where it's found and called them different things, but it's part of the whole spectrum. The point being that we're having this tissue, which is meant to be found only in the endometrium, being found elsewhere.
Yes.
So the first place you'd find it maybe is invading into the muscle. And if it goes and it's found in other places, there you go.
Okay.
So the theories of how it came about, some are theories are not entirely proven. One, people used to think about something called retrograde menstruation. So we learn about these theories in medical school, where for some reason, instead of the menstrual fluid coming out that way, it goes through the tubes. And so it carries some of those cells outside there. Not entirely proven, but hey, it's one of the theories. Another is just to say that, I don't want to use the big word, the cells lining the insides of your body, the abdomen, undergo a change and become that kind of cell. They just change to become that. It's just change. So those are some of the theories, but nevertheless, it's not so much the theories about what do we do once we find it.
Yeah.
Okay.
Okay. And I think, and I'm not sure that it's a misconception or misunderstanding, but is majority of the time endo is linked to a reproductive health condition. Is that necessarily true, or is it a misconception?
That's very good. So what happens when you have this continued bleeding and pain? Scars begin to form. The word we use first is inflammation. Inflammation is like when you have a wound and it's painful, it's hot. Or you have a sore throat, it's hot. So inflammation, it's hot. When you heal with scarring. So imagine tubes are supposed to be nice and free. But if you have scarring, things begin to stick on each other. So the tubes become blocked or kinked like that. That can have effects in the functioning of the tubes and hence the inability to conceive. So you have scarring. Not only that, it's not just the tubes. You'll find the intestines begin to stick to each other. So the intestines might stick to the bowel. That is, the intestines will stick to the uterus or to the bladder. And so structures which are meant to be free from each other now begin the anatomy, the relationship of different structures in the body becomes disordered and altered until you can even have what we call a frozen abdomen. If a doctor is to enter, you can't tell what's where. Everything is just stuck and matted together as one unit. And that's a problem.
Okay.
So you'll also have things like constipation, you understand, because the intestines are knotted and stuck on each other. Not good. And likewise, with the tubes being damaged, then you're going to get problems with fertility.
Yeah.
Also, depending on the type of damage, you might find that a conception happens, but because the tubes are not working well, the baby stays in the tubes. You get an ectopic pregnancy.
Okay, so that's the link between reproductive health and endometriosis.
There you go. So it's basically going to attack physically the structures related to proper reproductive capabilities in the woman.
Okay. All right. Good in that, because I know now that we've talked about it's a tissue that attaches itself in other parts of the body where it's not supposed to
and
be.
bleeds there
And bleeds
because
there.
it's scarring when it's healing.
Wow. I mean, that's yeah, that's something.
It sounds like the devil, doesn't it?
I know.
Yeah, it's horrible.
Yeah, it's a lot. Thank you so much, Dr. Wasuna. That brings us to the end of today's conversation, just unpacking what endometriosis and adenomyosis is. And I really do hope that you have learned something from today's conversation, particularly just making sure that you get to go see your doctor anytime you notice something is off with your body, whether it's pain or, you've just noticed certain changes with your menstrual cycle. Just make sure that you go see your doctor as soon as possible. I think, as Dr. said today, things could get worse, if you don't make that visit sooner enough. So the sooner you make your visit to the doctor, the earlier they'll be able to detect some of these conditions, and the earlier they will begin the treatment.